Major support for Carolina Business Review is provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. And Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
Labor Day is almost here, and even though summer is slowly but surely disappearing, some things are staying constant, and that includes the constant discussions and debates over health care. Thank you for joining me for Carolina Business Review, the most widely watched source for business and public policy issues across North and South Carolina. I'm Maura Quinn, in for Chris William. As lawmakers battle it out over health care legislation in Washington, the business of health care is growing jobs and changing the hot debate over generic medicine much closer to home. We'll launch that discussion and much more in just a moment.
Gratefully acknowledging support by Blue Cross Blue Shield of South Carolina. Please visit us at southcarolinablues.com. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Barings, a leading global asset management firm dedicated to meeting the evolving investment and capital needs of its clients. Learn more at barings.com. On this edition of Carolina Business Review, Dean A. Bundschu of Bunker Labs RDU, Otis Rawl of the Greater Lexington Chamber and Visitors Center, and special guest Lou Kennedy, CEO and owner of Nephron Pharmaceuticals Corporation.
So Labor Day is right around the corner. That means summer is almost gone. It's time to be thinking about the fall and lots of things like putting away the white shoes, right? And thinking about lots of things that happen in the fall. And Labor Day, thinking about the labor market, and so there's some kind of sad news for some folks up in the upstate. So Otis, let's talk about the news that happened. It broke a few weeks ago about the nuclear plant that was under construction in the upstate, and they stopped construction. What is the impact of that for the upstate of South Carolina?
Well, I think let's talk about the jobs first.
Yeah,
There's about 7,000 jobs that were on site out there. A lot of them were contract employees for different companies, and some of those folks will go back out of state, but we know that for certain there were about 600 Scanner, SE&G employees out there that's going to have to be out searching for jobs and all. But I think the thing that's more important for the business community than anything else is we saw those plants as a long-term solution for low-cost, guaranteed power, particularly in the Midlands and the lower part of the state, since SCANA provides most of that. What we're looking at now is what's rates going to look like to particularly businesses in our area. We're already a little bit higher than the national averages, and as we begin to make business decisions and as we begin to recruit industries into the Midlands, it's going to be part of that debate. I think a lot of folks were looking at nuclear clean energy at low cost, and it would be beneficial to everybody. So it is a surprise. So we're going to have to really go back and see where we go get the load that's necessary to address the electricity needs of guaranteed power, particularly to our business sectors.
Okay, so Dean, I'm going to get to you in a second. I want to do a follow-up question here with Otis. So do you think this makes SCANA possibly vulnerable for a takeover?
Well, there's always been discussions about SCANA and their particular size and the number of customers that they have. They've got somewhere around 700,000 customers. So if you look at Georgia Southern Company, you look at Duke, you look at Dominion, you look at some of those different kind of companies that are a lot larger, I think it does make them vulnerable. And you saw what happened with Duke and Progress Energy a few years ago in South Carolina. That was absorbed to make Duke one of the biggest power providers in the United States. Dominion already has most of the gas supply that SCANA had. So it's going to be touch and go for a while to see whether or not SCANA is structured are in a position that they can be bought for a reasonable price and consolidated. So I think the discussions are there, and we'll be watching that very closely.
Yeah, so let's bring Dean into the discussion. So we're talking about jobs, and that's basically what you do. You work on jobs with the military, and so military is big, important for both Carolinas. You work on connecting businesses that have a military focus. So tell me about some of the roadblocks that you have in the work that you do with these military businesses and trying to connect them.
Yes, I mean, our primary focus is to do everything we can to increase veteran entrepreneurship. And for the existing veteran businesses out there, it's to help them do whatever it takes to be successful. So you're absolutely right. In a lot of ways, if you look at some of our big partners out there in the community, we have the support of a lot of corporations. The reason being is a lot of those corporations want to do business with veterans. But the challenge is, and yesterday we had an event here, there's great organizations and resources that are experts at helping veterans because they have the relationships with the business community connect. The veterans oftentimes, I think, just have no idea whether it's, especially veteran business owners, they just have no idea that those organizations exist. So for us, as Bunker Labs, one of our biggest goals is to be that connector. So, and if you think about what we do, as an organization that's designed to facilitate and increase veteran entrepreneurship, the way we do that is by getting out into the community, building relationships with all the organizations in the community, and then connecting those veterans. Because veterans will tell you that one of the biggest challenges they have is building the networks as they transition. Because if you think about it, who's a veterans network? Primarily other veterans. So for us, it's plugging them back in to the tribe, back into the community. Right. So hopefully that ties into some of the things you're talking about.
And helping them find each other again.
Right.
Right. So talk about that in
Maya,
South Carolina.
I think that the model they got is an excellent model. And Lou and I sit on a group called Midlands Business Leadership Group. And one of the things that we're talking about is not only for veterans like Dean's doing, but just entrepreneurs as a whole, trying to just create a network where they know where to go to get answers to their questions, to be able to get response without having to jump 10, 15 different places to try to get those answers. And I think the model that Bunker Lab has put together, we can emulate in South Carolina and really help us address the whole entrepreneurial climate in our communities as well as our state. So we've already touched base with each other, and I think we're going to have some discussions down the road.
Yeah, I absolutely look forward to it. It's a challenge a number of states have, and I think the reason is being a veteran, transitioning, the message typically with veterans, and these are all important things when you're getting out, the focus is on continuing education through the GI Bill, it's on healthcare, and it's on employment. And oftentimes I think people don't understand the importance of veteran entrepreneurship. And the reality of the situation is that veteran entrepreneurs make up 10% of our GDP. If you go back throughout history, it's something I hammer home all the time, and it's arguably veterans were responsible for the greatest time of economic prosperity in the United States history, and that's after World War II. Almost half of veterans became entrepreneurs. The big thing is now is that number is about 4.5%. And the ramifications of that, I think, are the fact that there's 2.5 million veteran-run business owners right now. However, most of them are 55 years or older. So for us, if we don't find a way to help more veterans start and grow businesses, I think there's going to be a whole bunch of challenges. And I think you guys know this with automation, the way the economy is changing. A lot of the job opportunities that veterans are really good at right now aren't going to be here. So one of the best ways to help veteran employment is by helping them create their own opportunities. So
that's something that you're doing. So that's a great thing. So Otis, I want to switch gears and ask you a quick question about Dillon Inland Port. Right. So the Ports Authority is creating an inland port at Dillon. So what is the implication, do you think, from your wearing your South Carolina hat? So talk to me about the implication for North Carolina.
I think it really benefits both states a lot, since Dillon's right on the line. And what we've talked about, we've got an inland port up in the upper part of the state around BMW. And I think by creating the inland port in the Dillon, North Carolina, South Carolina boundary, it allows us to transport and get a lot of that congestion out of the Charleston I-26 corridor and use rail to get it out to the end of port, where we can load trucks up, load trains up, and things can go north into the Triangle area, into the metropolitan areas of North Carolina, as well as going into New York City, Philadelphia, and things of that sort. So it benefits businesses in a lot of ways. Reduced cost, on-time arrival of goods and services, but the biggest thing is it creates jobs in a community that needs a lot of jobs. We're a rural community, and as that inland port grows, we've got a chance to create an anchor in our PD area for jobs.
Right. So you have a real focus on the ports.
Yeah.
You really, you understand the ports.
Well, I just tell you, we're really excited about the 10% increase that the ports have, being able to handle the mega ships. It's going to be a game changer for South Carolina.
It is indeed. So we're going to talk about that and more, but right now we want to transition into bringing in our guests. Before we do that, I want to tell you about something really special that's coming up for Carolina Business Review, an on-location show. So this is a rarity for Carolina Business Review. Chris and company are going to be going to the South Carolina port. So we're just talking about it. They're going to be doing an on-location show in South Carolina at the ports, talking about transportation and infrastructure. So that's going to be special. You do not want to miss that. And then on a later show, going to be talking to Doug Lebda, who's the CEO of Lending Tree. So that is going to be something you don't want to miss. Now, our special guest right now is bringing jobs to her home state in a hot industry, generic medications. Nephron Pharmaceuticals Corporation is a woman-owned private manufacturer of generic inhalers and other pharmaceutical devices. Lou Kennedy is from Columbia, South Carolina, and that is where she has moved manufacturing and hundreds of jobs from Orlando, Florida. She transformed Nephron by creating a national sales force from the ground up, and that's a rarity in the pharmaceutical industry, and she increased her sales by 300%. Lou Kennedy is president, chief executive officer, and owner of Nephron Pharmaceuticals Corporation. Welcome to Carolina Business Review.
Thank you.
Thank you for being here. So the big elephant in the room, the debate over the ACA, the Affordable Care Act, and that has had a big impact on everyone's lives, but more than anything, it has got to have a huge impact on your business. So tell me about the biggest impact that it has had on your business.
Well, there's two ways to look at it. First of all, we know that a lot more folks were covered under the Affordable Care Act as it stands right now. So that would seem like a great thing for a generic company, and it is a great thing. You know, more access to generic medications is a good thing for us. However, we've got a lot of issues that need to be solved in the regulatory environment in order to be able to pay for the Affordable Care Act as it's written today. And I have had a very difficult time navigating the FDA landscape, trying to get new products to market quicker, which would help solve a lot of the cost problems that we have with the current Affordable Care Act. So a great thing happened a few weeks ago. The new commissioner, Dr. Gottlieb, announced that they would do everything in their power to expedite review of generic drug applications from what previously took somewhere between 3 and 4 years to a really quick, hopefully monthly process. So this will apply to items that are on the drug shortage list or drugs that are so old that many of the big guys have decided to stop making them because they're not as profitable. So this was a just welcome sigh of relief, a breath of fresh air from this new commissioner. And so we're very hopeful that we can submit some applications in the next month that will help with the drugs that are on shortage lists. And this is, I mean, our hospitals are in a crisis mode right now for something as simple as sodium bicarbonate. And so right now, Nephron Pharmaceuticals is one of only 2 players in the country shipping those products to hospitals, and they're needed during surgery. So we're really excited to be a part of the remedy, not the problem. And I think that we look forward to seeing how the Affordable Care Act will roll out, what's going to make its way through, what will pass and what won't pass. And as a generic manufacturer, we're right in the middle of it.
Yeah. So what's your biggest concern as this debate moves forward now?
Well, we have to solve how we're going to pay to cover these individuals. And the way we can solve that is to fix many of the regulatory concerns, and the agency itself has many things that they can do, and things that are on the docket that if these things pass and are approved will help us get these medications to the patients. You know, we've got to solve how we run hospitals. The whole landscape is changing, and as a person who sells to the hospitals, we're watching that with a very close eye, because we need to be able to add value and help us pay for the issues that we have here in healthcare in the U.S.
Okay.
Look, I think from a business perspective, I think one of the biggest issues is just the escalating cost. I think for most businesses in South Carolina, looks like it's going to be a 22% increase in premiums for individuals and for companies. Or Arizona, it's even more than that. I think the real issue with that companies like Nephron are able to provide us is a lower cost way of distributing medicine. I'd like for you to just talk about the cost, what portion of the cost generics are to just what, you know, across-the-counter type drugs, and what kind of savings that can be for businesses on things y'all bring to the market.
So when we get to market, we're usually a third or fourth to file. The price of a product drops by as much as 85–90%.
Right.
So that alone is a huge savings. I will say that we use a lot of automation and robotics at Nephron, so we control costs, and we are able, I mean, our products sell from 6 cents a dose to a little over $1. So they're not whopping margins, and we have to figure out how to be lean and mean. Of course, we like to hire good veterans to operate our equipment and make sure that we keep things in check. But I have to say that if we can solve some of these tax issues, you are so spot on. Our competitors, Mylan, the people we sell to, Walgreens, CVS, they're all operating their businesses with tax inversion outside the U.S. So we're out of the gate paying 40%, they're paying 12%, and in Mylan's case, 9% in taxes. That's it. Yeah. So, you know, we've got some things to solve both on the tax side and on the regulatory side for FDA.
Awesome. No, I mean, the one thing that you hit on that's obviously near and dear to my heart is the workforce development piece, especially when it comes to veterans. So I just wanted you just to talk a little bit about why veterans are a good fit for the organization, what kind of roles and what kind of future roles you potentially see.
So out of our 475 employees, we have a lot of veterans, and we look for veterans because we make sterile drugs. And to make a sterile drug, you have to follow a standard operating procedure, numerous layers of protocols, and other things. So in saying that, a person who's been trained in the military knows how to follow a chain of command and an order and stick to the script, right? Yeah. So we are always happy to recruit veterans because we feel like they come to us primed and ready for the needs that we have in our workforce.
That's awesome. Mostly what type of veterans are those? Like what type of skill sets are they?
Management, we've got them in calibration, we've got them in all areas of automation, quality, investigations.
Really good at sales too. Did you say you guys built your sales force from the ground up there?
That's correct. And I'm trying to think, I don't think I have any veterans on the sales force. I have had in the past, but not right now.
So you moved your business from Florida to South Carolina. What were some of the challenges and opportunities of moving an operation from one state to another?
Well, it was very difficult to do business in Florida. Florida is really geared for hotel, restaurant, tourism. Manufacturing's not their first person to recruit, in my opinion, and particularly not healthcare manufacturing. So being in a manufacturing state, South Carolina is just a blessing. It's truly been a pro-business environment. Everything about navigating the state regulatory body has just been easy to work with. It's been just a pure source of joy. But I will tell you that moving from Orlando to South Carolina, from Florida to South Carolina, has been very challenging because you have to time your production correctly. You got to make sure that you can supply the market, get the necessary drug approvals to allow you to move it. make sure that you train the workforce while you wait for the approvals. So we were in operation for about 18 months waiting for FDA approval with not a penny of revenue in sight. So it was about a $2 million drain on our bottom line for 18 to 24 months waiting for FDA approval. It was very difficult. It was not for sissies.
No kidding. Very hard.
So Lou, South Carolina doesn't have many headquarters in our state. We have a few, but not many. What do you think we have to do as a state, and particularly the community in the Midlands where you're located, to entice more headquarters to come into our community? What does it take?
We've got to talk about it. Yeah. This has been a true exercise in ease and business happiness, as I said, and we've got to talk about that. We've got to build our brand. More of us that are in, a leadership position, and particularly when they're headquarters, we've got to tell other leaders and embrace other conferences and get out there and talk about how great it is to do business in South Carolina.
And talent retention and finding the right talent. So you found some veterans, but what about other talent? What are some of the challenges and the opportunities that you're finding in finding the right talent?
Well, the talent pool is just over the top, and I'll tell you why. Folks that grow up in South Carolina want to live near their mamas and daddies. So when they can't get a job, they'll go get another degree. So I have more PhDs and master's degree individuals than I could ever recruit in Florida. And so we've just been overwhelmed by a number of resumes that come in for anything we're trying to recruit. Anything.
Yeah. You are a real South Carolina girl.
That's correct.
Yeah. So did you ever think of any other place to move other than South Carolina, or was South Carolina it?
No, I had never planned on building the headquarters back in South Carolina. We purchased the land and intended it for Florida. But you know what they say about not ticking off a lady. And so the permitting office there did. And I made a phone call to a South Carolinian and said, hey, what do you think about opportunities for our company in South Carolina? And within 2 or 3 days, Department of Commerce was at our doorstep. That was in August, and by October we announced we were moving home. And so my husband and I are both South Carolinians. We're happy to be back.
Yeah, I think Lou brings up an interesting point. We probably had the greatest renaissance in advanced manufacturing over the last 8 years, and a lot of that can be attributed to former Governor Nikki Haley and Bobby Hitt. And I mean, I will tell you, I know the relationship that Lou and Nikki's got, but their relationship is just like any other relationship. We had a governor would actually give you her business card, write her cell phone, and say, hey, we're going to want to make it work for South Carolina. And it's that kind of get-do kind of attitude that we've experienced that it's really taken us from losing 168,000 jobs in 2008 to putting over 250,000 jobs, I think, back into the advanced manufacturing. But to go to Lou's point, I think that with robotics and changes and with the number of companies that we've had announced in South Carolina, it goes back to what Dean said. We've got workforce challenges in South Carolina just to be able to develop the type of entities and individuals we need in these companies and all. And it's putting a stress on our technical colleges, our research universities, and Lou's finding them, but we got to be able to find them for all these other companies too and all. And it's a challenge. So
do our own training too. We recognize that the technical colleges are being pushed to the limit, and so we are working with them and together to build our own on-the-job training to augment what we get right out of the technical schools. And we've now just started a process with the local high school. Let's just start at a high school age and become a partner and show these kids that we have a great place to work, and here's how you train to get there. And so we're starting earlier.
So you are thinking about expanding?
Yes.
So what are your expansion plans that you can talk about?
Well, we have a startup company for a device that we've got being built and manufactured and assembled across town. That was just launched in April. We started a new division of the company this past January that has doubled every month since it was in existence. We've had the best July on record the company's ever had, and all that with prices and generics going down. So it's a great day. and we're just pushing ahead. And my goal is to, never be scared of a big public company. In fact, I announced we won a Facility of the Year award, a global award, a couple months ago, and I told everybody in the room, big guys like Bristol Myers Squibb and Jazz and Eli Lilly, I said, we're coming for you. And so I'm ready to go. We're just pushing ahead, and I'm happy to be in South Carolina doing it.
I would tell all of them to keep their heads low because Lou is coming, don't you think? Lou, thank you so much for being here.
That's
Dean,
awesome.
Otis, thank you very
Thank
much for being a part of this conversation. And thank you for being a part of the conversation today on Carolina Business Review. And don't forget, you can see more information and you can see prior shows on carolinabusinessreview.org. Thanks again for being with us.
Major funding for Carolina Business Review was provided by the Duke Endowment, Barings, Grant Thornton, Novant Health, Sunoco, Blue Cross Blue Shield of South Carolina, and by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.